Planning has been defined as a process of analyzing the problem as it exists currently and assessing the need for improvement, formulating goals and objectives, assessment of resources, and choosing from alternative intervention strategies to tackle the problem, initiating the necessary action, monitoring the action to ensure proper implementation, and finally evaluating the results of the intervention. Although this is the definition of planning, it actually is the enumeration of the steps in the process of planning for any purpose. The same basic steps which were enumerated in the previous slide are followed in the planning for any purpose. Planning may be required for various purposes like controlling a particular health problem or establishing a new clinic, organizing a health education session, health planning at national or state level, development of other sectors, that is other than health, for planning of upliftment of food and agriculture sector, better education, housing, power, etc. In this lecture, we shall discuss about health planning. The steps in health planning have been enumerated below. We shall discuss these steps in a little more detail in the following slides and followed by an example to further clarify the concepts. The steps are: first, analysis of the health situation, establishment of objectives and goals, assessment of resources, fixing priorities among both the objectives and the alternative solutions, write-up of the formulated plan, programming and implementation, monitoring, followed by evaluation. Evaluation reveals the new health situation, that is the situation that is become after the program has been in place for some time. And the new situation will lead to new objectives and new assessment of resources, and hence the planning cycle continues. This slide shows the steps of a planning cycle in the form of a cycle. We shall now discuss each step in a little more detail and try to clarify the concept. The first step in health planning is analysis of the current situation. This means data collection for assessing the burden of the disease, the present burden of the disease in the population and its distribution. So it involves data collection to identify the current status of the issue under consideration. In addition to the distribution of the disease, different major aspects have to be studied for planning process, and these are the population structure, morbidity and mortality rates of the population, morbidity and mortality rates specifically to the disease under consideration, epidemiology of the disease, existing healthcare facilities to deal with the disease, and technical manpower available, facilities for training more manpower, awareness of the community regarding the disease, attitude of the community regarding the control of the disease, and many such things of relevance to control the disease. The second step is establishment of objectives and goals. What is an objective? Well, once we have studied the present situation, we have to identify a desirable future state for the issue under consideration. This is an objective. For example, a person lives in a society where the proportion of population below poverty line is 30%, and he desires that in future I want to live in a society where there is no poverty. This is the desire, but the desire has to be quantified to become an objective. He decides that given the circumstances, I would like to have a society where the poverty level is at the most 5%. So 5% poverty level is the objective that he would strive to achieve. Objectives establish the standards against which the current disease profile will be compared and we can assess the performance of the program. That is how close to the level of 5% have the program been able to take the population. So once we have an objective, we have a site, we can compare the working of the program at a later date. If there are no clear objectives in sight, a plan cannot be implemented efficiently and some haphazard activity will result which will be wasteful. These objectives are more general at the central level. For example, at the central level of the organization, we'll say, I want to live in a society which is free from poverty. But as the level decreases, the objectives become more specific. At ground level, we will strive for achieving a poverty level of maximum 5%. Now, how have we reached this level of 5%? Why not 10%? Why not 2.5%? For determining the objectives, we have to know that the objective has to be feasible. That is, it should be possible to attain that objective. It may not be possible to attain 0% poverty, but it may be relatively practical to attain a value of 5%. If we attain a value of 10%, then it may be less performance than what we can actually do and may not be that productive for the nation. So we have to strike a balance. And before we decide on to the objective, the level at which we want to bring the present problem. So various management techniques like cost benefit analysis, input output study will help in deciding the level of the objective. For example, bringing the poverty till 5% level will increase the productivity of the nation. But if we try to bring down the poverty to further 4%, that reduction of 1% may require much more input than the benefit that will be available by this reduction. So we have to balance out. And hence the management techniques like we just mentioned, cost benefit analysis, etc., will help us in determining a feasible yet effective objective. The one example is like to reduce the prevalence of the disease under question to a level of 0.5%. The third step is assessment of resources. Resources include time, manpower, money, materials, skills, knowledge, technology. A balance has to be struck between the available resources and attainment of the objectives. We have discussed about just one objective, that is reduction of poverty to 5%. There may be so many other problems in the society along with poverty, like a public health problem of tuberculosis, leprosy, vaccine preventable diseases, a high prevalence of undernutrition in the under 5, and so on. The resources, whatever is the amount, are usually not enough to deal with all the objectives at the same time. So in accordance with the available resources, we have to prioritize that which objectives should be dealt with first, followed by the other ones. So priority goals should be listed out and resources should be allocated to these first. Various criteria can be used for fixing priorities. It may be in order of magnitude, that is high mortality and morbidity rates. Maybe lower costs are required to achieve the objective. So we will deal with that objective first. Or maybe it is involving saving the life of young people. Sometimes it may be the political commitment with the promise that the party has come to power. We might have to fulfill that. So political pressures. And so there can be many criteria using which we can fix which objectives to be attained first and then striving for other objectives. This is known as fixing priorities among the objectives. So once the priority objectives have been decided, there can be so many ways of achieving them. So we have to assess the alternative ways and prioritize the most feasible one. So the step also involves identifying the range of solutions to the problem and comparing them for feasibility, cost effectiveness, etc., and giving the priority to the most suitable one. Once again, the management techniques help us in prioritizing the solution from the alternative solutions that can be undertaken. An example is given below. A prevalence of a particular disease has to be reduced to a particular level. Now, whether vaccination is more cost effective or treatment of the cases is more cost effective in bringing down the prevalence. For example, the disease itself may be mild and require inexpensive treatment, and whereas vaccine may need to be imported and become very expensive for mass application. So hence a program for early diagnosis and treatment for the disease would be preferred over vaccination for achieving the target prevalence rate. So once again, management techniques come handy for comparing the efficiency and efficacy of alternative plans and in deciding the priority of which alternative solution is best suitable for the given situation. Once the priority objectives have been laid out and the best suitable solution has been chosen, a systematic plan of action has to be developed as to how we will achieve the objective and has to be put on paper. All the major steps in the plan should be included in the write-up and should also include the resources required for each step, the expected outcome after each step, and the time period that each step would take. In addition, we also include the precise guidelines for the workers, how they are supposed to work, what procedures they are supposed to carry out, and what are they supposed to do in some special situations. Also, fixation of responsibility, that is, we have to identify the individual who will be responsible for the execution of each step. The sixth step is programming and implementation. Once the plan has been approved and put on paper, it becomes a program and it has to be implemented or brought into action. Now, this bringing into action of the program requires an organization to run it. The organization runs it, and the real shortcomings or impracticalities which were not thought of till the write-up will be revealed at this stage. The implementation part involves identification of the personnel, definition of their roles and tasks, training the personnel for their particular task, organization of a communication so that all the workers are aware of their responsibility and they remain motivated to work, and actions to be taken so that all the institutions that are involved are working efficiently. Seventh step is monitoring. Once the program is in full steam and running, monitoring has to be done. That is, day-to-day follow-up of the functioning of the program has to be done. Otherwise, there will be some laxity. In monitoring, it is ensured that the activities are proceeding as planned and are running on schedule. And immediate corrective actions is to be taken in case of any deviations. So monitoring has been defined as the continuous process of observing, recording and reporting on the activities of the organization or of the project. Evaluation means final assessment of the program. This involves evaluation of the results of the implementation of the program to find out if the solution has been effective in achieving the objective or not. The evaluation is done in terms of degree to which the objective was achieved and how efficiently have the resources been utilized, any wastage factors or something that could have been avoided in achieving these. If there have been any shortfalls, that has to be reported, and what were the factors that were responsible for the shortfalls have to be assessed. Similarly, any better performance, better than expected, and the factors which led to this better performance have to be studied. Difficulties faced during the implementation and possible solutions for these, lessons learned, etc. form a part of the evaluation. A good plan would have an inbuilt evaluation system. That is, there is a provision from the very beginning of continuous collection of data which ultimately will be used for evaluation. The monitoring data is also used in evaluation. So monitoring data is a part of the evaluation data. Depending upon the outcomes of the evaluation, one of the following recommendations can be made. It may be recommended to continue running the program as such because the results have been satisfactory. Or it may be recommended to make a few changes to improve upon the discrepancies found and to overcome the efficiencies and let the program continue in the second phase. Or it may be recommended to change the objectives because the program has achieved a lower prevalence level. So new objectives of a still lower prevalence level may be set and a new program may be built up. Or it may be recommended to totally abandon the program and analyze an alternative approach because the program has either failed to achieve the objectives or suddenly a new or more effective technology have been developed in the meantime for controlling the disease and it needs to be incorporated in the program. Or a new or more dangerous health problem has emerged and now that becomes the priority and this one becomes the second priority, etc. A hypothetical example has been shown to further clarify health planning. Remember that the example is hypothetical and has been extremely simplified for the understanding level of an undergraduate of the planning process. The plan is for achieving 100% immunization coverage among 0 to 15-year-old children against the 6 CPI diseases in a given district. The first step is analysis of the situation. So a survey is done to assess the current status of immunization coverage and following are the findings. Shows that the coverage of immunization is 31%, 28.1% and 20.5% in the age groups of 5-year-old, 5 to 10 and 10 to 15-year-old respectively. And the total coverage among the 0 to 15 age group is 30%. After assessment of the current situation of immunization coverage, we see that there is a gap of 69% in 0 to 5 years old, 71.9% in 5 to 10 years old and 79.5% in 10 to 15 years old. A total gap of 70% in the immunization coverage. So our desirable future state is to increase the immunization coverage by 70% in 0 to 15 year age group. So after setting our goals, the desirable future state of 100% immunization, now we pay attention to the resources that we have. We see that the budget is insufficient, the total number of personnel who are actually trained for immunization is insufficient, there are few more who can be trained, total number of health centers are just adequate, the equipment available for immunization is inadequate. It is seen that vaccines and syringes can be intended as per the requirement, but it will take 3 to 4 months to come to us. It is seen that the workers have no motivation. We also note other personnels who can be used in our program. And it is observed that the electric supply is only for 8 hours a day in the district. Within these given resources, we have to set our target and get working. Given the limited resources, we finalize that we cannot increase the coverage in all the 3 age groups. So we have to limit ourselves to 1 age group out of the 3 age groups. The points in favor of 0 to 5-year-olds is 7. Points in favor of 5 to 10 years old are 2. And in favor of 10 to 15-year-old, just 1. So basis on this score system, we now decide that our priority group is 0 to 5-year-olds and that we will strive to increase immunization coverage in only this age group for present. So we have seen that as we cannot target all the groups, we decide on to 0 to 5-year-old population for maximum advantage. For fixing priorities, cost benefit ratios, input output analysis and many other management techniques are there which can immensely help in deciding the priorities. we have prioritized 0 to 5-year-old age group for increasing immunization coverage. Now we have to prioritize the method of doing so. We have to assess different ways of achieving the value of 100%, and we have to prioritize which method are we going to use. Once again, management techniques help in deciding the best strategy for the given situation. For example, we can think of many alternative ways, like train the untrained workers for vaccination so that we have a bigger team who can vaccinate, and meanwhile indent the required vaccine and then start vaccinating the 0 to 5 years old. Or we can employ all the workers and school teachers to spread awareness and converting the need of immunization into the demand, and then we hold immunization clinics in the existing 113 health centers. Another alternative strategy can be that we use the already trained workers as a team, which will move from village to village and hold camps once in a week in each village, while the untrained workers and teachers can increase the awareness regarding the need for vaccination so that parents bring their kids for immunization to these camps, which is held once a week, and the day of camp can be communicated to them. Each of the above three approach has to be assessed and compared for feasibility, efficiency and time required. Here again, management techniques will be of immense help and will help you in deciding the best suited strategy for the given scenario. Now we have finalized the priority group to be 0 to 5-year-old and the priority strategy as the camp strategy. Now we need to write down the plan on paper and convert it into a program. The write-up includes the step-by-step actions that would be taken. That is, when will be the vaccines indented, when will be the training sessions held for the workers for health education and workers for vaccination, when will the health education material be printed, the dates of starting the immunization camps, what will be the plan of evaluation, and timetable can be prepared for ensuring timely completion of tasks. The write-up will also name who will be responsible for which aspect of the plan. It will also name the workers who will be responsible for immunization, those for organizing the camps, those for spreading health education, etc. It will also name who will monitor the entire process so that there is no laxity. It will also underline the methods for monitoring. For example, it can be regular noting of cold chain temperatures, number of beneficiaries visiting each camp, number of health education sessions held per village, small feedback surveys from each village, etc. It can be any method, it has to be written down. And it also needs to mention how will data be collected simultaneously, which will be used for final evaluation after 1 year. For example, daily reporting of vaccine preventable diseases, small surveys at village level for assessing the increase in immunization in those areas, etc., can be done simultaneously and can be used at the end for final evaluation. Implementation of the program, that is bringing the program into action. That is start implementation of the program according to the timetable in the write-up of the plan. The various activities would be to start indenting the vaccines and cold chain equipment, to start training the workers, explain them their responsibilities, health educators to start immediately after training so that the villagers are ready to bring the kids for the camps once these start. Then start holding the camps once vaccines and equipment are delivered, etc. That is, whatever is written in the write-up has to be brought into action according to the timetable. The program has started and is running full steam. Now the monitoring has to be done. That is, day-to-day functions have to be monitored so that the program functions and moves as is given in the write-up. For example, in this case, the in-charge notes down the timings of supervisors reporting for duty and their timing for leaving for field work, noting down the number of health education sessions held at each village and ensuring that the correct information is being delivered at these. Number of camps that are held regularly and as planned can be noted down. Vaccination, cold chain equipment maintenance is done as prescribed in the write-up. Each adverse reaction is immediately followed up as per the prescribed procedure in the write-up and is reported. Any shortcoming or lack of foresight in the plan is not reported to the in charge, and the plan can be adjusted to overcome these, or just notification can be made. So basically, it is day-to-day monitoring of each activity that is there in the write-up, so that the program proceeds as per the plan. Without monitoring, the program will stop somewhere, everything will go haywire. Finally, at the end of 1 year, we will perform the evaluation of our immunization program. How can we do it? We can conduct immunization surveys among all the age groups to see what percentage has been immunized and what percentage of the objective has been achieved. We would need the routine monitoring data also to assess if everything has progressed as planned. We can conduct qualitative studies to know the difficulties that were faced by the workers, the reasons for reluctance of villagers for vaccination, and other problems. Any additional or unforeseen benefits are also noted down, and why they have occurred is also searched for. In other words, evaluation is an elaborate project which assesses each and every aspect of the plan of the program and assesses the performance of program in every sphere and brings out the strengths and weaknesses and lessons learned and suggests recommendations. Let's say in our example, the outcome of the evaluation can be that the program has performed satisfactorily. There is 87% coverage of 0 to 5 years old. There is some increase in coverage in other age groups also, and hence we can continue the strategy and then extend the strategy to other age groups too. On the basis of this, we can demand more resources and actually include other age groups as well. Or the evaluation may find that the coverage has increased but it has only reached up to 45%, and the reasons which were found that were that the workers were not interested, the health education sessions that were held were not in the local languages, or it may be that the villagers were facing problems in commuting to the camps. So the recommendation may be that change strategy which includes a solution to the problems that were detected in the evaluation. Or the finding of the evaluation may be that the coverage has not improved at all, it has remained 30%, and that unforeseen problems like law and order problems have hampered the program. And it may recommend that there is a need to assess a new strategy like providing security for the workers, improving literacy status before the results can be expected from the strategy. Health planning at national level. National health planning involves planning for improving the health of the population of a nation, state, etc. This national health planning is the orderly process of defining the community health problems, identifying unmet need, that is the objectives for each problem, surveying the resources to meet them, establishing priority goals, and projecting administrative action to accomplish these, which administrative action means implementing, monitoring, and evaluation. This slide shows the national health planning in a pictorial form. This involves analysis of the health situation so that the health problems of the population are formulated. Our population is affected by many health problems, so the most common ones are identified. For example, in India we find there will be tuberculosis, leprosy, poliomyelitis, undernutrition among under 5, vitamin D deficiency, and so on. There will be around 15, 20, 25 or 50 health problems which are majorly present in that population. From these problems, the priority ones are chosen because program cannot be made for each of the health problem that is present in the population. So priorities are assigned. For each priority problem, planning solutions have not to be found. So for each disease, objectives are defined as we did in the example, and among these objectives, priority objectives are defined for each problem. For each priority objective, alternative programs are to be assessed and the best one chosen for each disease. So select the best program for each disease. This one program for each disease is combined into a national integrated plan for health development. Now this integrated plan is then initiated, implemented, which involves orienting and training the personnel and initiate the program, that is initiate the treatment or control whatever is in the write-up for each in the integrated plan. This also involves monitoring. Operate the program involve monitoring. Simultaneously collect data for evaluation and evaluate the results at the end and see if the goals are achieved, if the program is running satisfactorily or not, the integrated program. If it is running satisfactorily, we can continue to operate the integrated plan, national health plan. If it is unsatisfactory, we will again formulate health problems and reconsider the priorities and make a new plan, and the cycle continues. Following concepts will be explained in part 2 of the lecture on health planning.